While our health may feel like an intangible thing, it actually impacts on every aspect of our lives, from our emotional and social to our physical well-being. So what influences your wellness? I'm meeting with esteemed clinician and medical historian Professor John Pern for insight into how historical health events may affect how we think today.
Welcome to our hospital.
Thank you. Thanks for having us.
In Queensland, there's no better historical example than the Spanish flu epidemic of the early 20th century.
It was the worst catastrophe ever to hit the human race. Somewhere between 50 and 100 million people died worldwide. We learnt, well, we being the world, learnt so much, and of course epidemiologists and preventive health experts, and wonderfully in Australia, our own political leaders have used many of the lessons from that 1919 pandemic to really guide and keep Australia safe today.
Can you describe the level of community concern when the Spanish flu hit?
Very similar to what we've experienced in the COVID-19 response, in that borders were closed, isolation was promoted, everybody wore masks, just as we're doing today.
The sun shining down.
Fast forward from 1919 to the 70s, and health messages on TV started making an impact. They began to make us question our health behaviours and encouraged us to think differently.
Slop, slap.
Consumer and behaviour change expert Dr. Joy Parkinson remembers this campaign well.
We know it's all about putting on a hat, putting on sunscreen and putting on a shirt as well to protect ourselves from the sun. Slip Slop Slap has really contributed to reducing rates of skin cancer and melanomas in Australia. These types of campaigns, take time to take hold, but they really ingrain what we do and make those things habits.
Walking is free.
It was the beginning of an era in public health messaging.
The 6 tinnies on this side balance the 5 cakes.
As we came into the 70s, we really started to see some of those more people-friendly communication programs that really supported public health and really supported that change in social norms as well, so change in how we do things in society.
And when campaigns like these are combined with other measures like laws, public policy or services supporting behaviour change, the results can be powerful.
Other things like Life Be In It with Norm, when we were all getting TVs and VCRs and sitting around on the couch, and fast food started to become a thing.
Who are you calling fat?
You!
Some of the smoking campaigns as well, and they've worked really well, particularly in Australia, because we know, thinking about nobody smokes here anymore, so really changing that social norm around smoking and how it's antisocial.
Every cigarette is doing you damage.
It used to be a cool thing, but it's not cool anymore.
So we see history and public messaging shapes our health beliefs and behaviours. And according to dietitian and credentialed diabetes educator Michelle Tong, there are other factors at play.
I work with a lot of culturally diverse groups, and I think culture has so much to do with how people think and act in general, let alone, their health.
In what kind of ways?
So different cultures perceive, say, their health conditions very differently. So take, for example, diabetes. If Pacific communities might take it that, type 2 diabetes is God-given, whereas other communities would really listen to the health professionals in terms of, their advice on how to look after their diabetes. With all health conditions, we are all individuals, and in particular when it comes to cultural differences, we really have to consider what kind of background and understanding they're coming from in order to provide, the best advice that we could support them.
Food and culture are very strong. That would have a big impact as well.
Absolutely. I guess if you think about it, whether it is the foods that we eat, or whether you believe in meditation or abstain from alcohol, or the kind of mindfulness that you practice, all of those definitely play a huge part in terms of making, the health decisions.
For Daniel Weil-Wall, it was his upbringing and experiences after appearing on the popular TV series Ninja Warrior that set him on the path to holistic wellbeing.
I come from a family that survived on, the basics, so like rice, meat, root vegetables. Wellness is something that I think is something that needs to be approached holistically. So physical well-being, mental well-being, emotional, spiritual. So, it's not only about the physical body and what you eat and put into it, but it's the whole being. I like to ground myself and focus on myself and still get out and do things, but for me, it's just everyday life.
Today, the Townsville youth worker helps others on the path to holistic health and shares daily motivational tips on his social media platforms.
To share this now on a platform across all of Australia, it helps me tell my story and to show people that no matter where you come from or who you are, if you put your mind to it, you can really do whatever you want.
Health and wellbeing seems like a jigsaw made up of many parts. It can include education, societal, economic, environmental and personal factors.
Take a seat.
I'm keen to get Health and Wellbeing Queensland CEO Robin Littlewood's perspective.
So I understand now the external factors on our health, but what about those individual things, the personal things that we can do to improve our health and well-being?
I think that to function well, we've got to make a real commitment to our health. It can be one of the most important things that we can do for our own lives. Good health is actually made up of many things, not just a single focus.
And what are those things?
Some of these are exercise and movement, and really trying to find time for that in our everyday lives, and try to find something that you really like. Healthy food and healthy eating. Being mindful and having a really positive mindset, that's incredibly important right now. Getting sleep, but getting good sleep. Social connectedness as well, because it is so important to link in. All of these are needed and they're all equally important. The key, like everything else, is balance. We've all got the right to good health and we've got to remember that.
While there are some factors that are difficult to change about our health and well-being, it seems there are things within our control. Look at what you can change, as small, gradual health changes can lead to big benefits. So there you have it. The picture of good health is actually a jigsaw of many pieces. And that picture is about feeling good and living and ageing well.